The different disorders of the muscles and masticatory joints of the head and neck region, often accompanied by pain, are among the most common musculoskeletal disorders, collectively known as temporomandibular disorders or TMD. The main symptoms include pain in the chewing muscles and in the temporomandibular joints, abnormal movements and various sounds from the masticatory joint. These sounds can be clicking noises, but in many cases, if the joint is in bad condition, even cracking sounds. One of the oldest treatments is movement therapy, where we can perform exercises that can reduce pain or even improve the altered movements and the accompanying pain. In the next few minutes, we would like to show some exercises which were recommended as temporomandibular joint movement therapy for patients of the TMD working group of the Department of Prosthodontics at Semmelweis University. Healthy mouth movements are very easy to recognize. The mouth opens unrestrictedly, the jaw moves up and down in a straight line. If the jaw movement is different and has an S or C shape, or if there is less than 35 to 40 mm between the upper and lower incisors in the open position, it is worth consulting a doctor. A clicking joint is usually caused by an incorrect position of the articular disc or the mandibular condyle. In this case, during exercises, the patient moves the jaw slightly forward so that the lower front teeth meet the incisal edges of the upper teeth. From this forward position, the jaw is opened and then closed back to the same forward position. The exercise should be done slowly, 10 to 12 times a minute for at least 5 to 10 minutes, twice a day. If done correctly, the clicking sound is no longer heard from the joint except at the first opening. There are also cases where the articular disc moves out of its normal position and it cannot gain back its normal position. In this case, after an initial period of very painful, limited mouth opening, it is more difficult to recover normal movements. Our aim with the following exercise is to help the articular disc to return to its normal position. The patient bites on a cotton roll or a rolled up tissue on the painful side where the joint movement is limited. So, a gap is created between the teeth on the other side, which the patient tries to reduce by clenching the teeth. Of course, most of the time it is not possible to close completely, but that is not the goal. After 2 minutes of biting, the cotton roll is removed from the mouth and the jaw is moved loosely sideways. Then, a few times, with the mouth closed and relaxed, draw horizontal H-shaped figures with the tongue by pushing the tongue forward, to the left and then backward, diagonally right forward, then back again and left forward. In the video, this is first shown with the mouth open to demonstrate the correct tongue movement, but the correct technique is to keep the mouth slightly closed. At the end of the exercise, we can also try the opening exercise with the forward position of the mandible, but carefully. If it hurts, we shouldn't force it. It is worth supplementing the previously shown exercises with the side opening. The patient moves the jaw to the opposite direction from the painful and difficult to move joint and then tries to make an opening movement from there. The restricted movements can be improved by a spatula exercise, where a wooden spatula or a small spoon is placed between the upper and lower incisors and the patient moves the jaw back and forth and then right and left. For muscle pain, the following relaxation exercise can be used. The patient should place the tip of the tongue on the roof of the mouth and, taking a deep breath, slowly open the mouth so that the tip of the tongue is still touching the palate. When the open position is reached, the patient should hold the breath for a while and then close slowly the mouth while exhaling, but without clenching at the end. The exercise is repeated slowly, 10 to 12 times per minute. Inhaling promotes activity and exhaling promotes relaxation. With these presented exercises, we wanted to raise awareness to the importance of practicing at home. However, it is very important to note that these exercises should only be done under the supervision of a qualified physiotherapist or a doctor.